All right, I think we're back in business. Well, we're going to try to make it work. I guess they know that I want to talk about these Medicaid cuts. Many of you have asked me about the Medicaid cuts and how that will affect seniors and how that will affect those who are on Medicaid and also those with disabilities and caregivers. So I want to provide some information in that lane to you tonight, as well as answering any of your questions that you have about dementia and caregiving. That's what I'm here for. That's what we're all here for. So be sure to pop your questions in the chat, pop your comments in the chat. Now, this is a subscriber only chat. So if you're subscribed to the channel, you'll be able to drop your questions and your comments in the chat. But it is a member priority chat. And what that means is if you are a member of the channel, you will have priority in terms of your question will be posted on the screen and I will get to your questions first. So if you're not a member of the channel, please join the channel. If you are an advanced member of the channel, the resources that we discuss here tonight, I will actually send you out a link to access resources in your area that's searchable by your zip code. And so if you're an advanced member, keep an eye out on your post chat tab. So that post tab that's on your YouTube channel, on my YouTube channel, but on your feed, go to your post tab. That's where I will be sending you all the links to resources that we discuss here tonight. So that way you can follow up and access those resources for your loved one, but also for you as a caregiver, because it is going to be caregiver resources. So again, it looks like everybody can hear me. So let's talk about these Medicaid cuts that were approved by the Senate and the House. So it was approved by Congress. And these were some of the cuts that were in Trump's bill. He calls it the big, beautiful bill. And so, what I'm going to do is just kind of recap some of the things that were highlighted on NPR. NPR is a very trusted resource that I get my information from. So, the first area that's identified as a cut or as a huge change with this particular bill is that many people will now have to work to stay on Medicaid, not Medicare. So Medicare is the health insurance one gets when they turn 65. So that's based on age. This is Medicaid. Medicaid is the insurance one gets based on income. And if it's for an older person or a person with a disability, it's based on level of care. So the amount of care that you need. And so with this particular area, people will have to work, attend school, or volunteer at least 80 hours per month in order to remain on Medicaid, or they may qualify for an exemption. This exemption includes caring for a young child or caring for a child with a disability or caring for an aging family member. So, as a caregiver for a young child, for a child with a disability, or an adult with a disability, or someone who's aging, you may be exempt from the Medicaid cut in terms of that work requirement. And I'm going to go back through it. So, again, pop your questions in if you have a question in the chat. All right. So that's the first requirement. There's a work requirement. The second area that we need to look at that draws caution. Less cash means less care in rural communities. So many of the rural hospitals and the federally qualified health centers that you see in rural areas that accommodate low income or no income individuals, they would get Medicaid taxes. So they would get some funding, extra Medicaid funding to help sustain those hospitals and to help provide care and support to those in rural areas and in underserved areas. So those individuals with low income or no income, those particular hospitals and medical providers would actually receive additional Medicaid payments, also known as provider taxes. So they would get those hospitals and those medical practices would get extra funding from Medicaid to accommodate that. Now, to accommodate the care. Now, without those extra dollars, they won't be able to sustain those practices. They won't be able to provide support and care. Within the past couple of years, those hospitals reopened. I'm from South Carolina, very rural South Carolina, and many of the hospitals closed in my area, but then some of them came back online. This bill includes cuts that will take them back offline. So that is definitely an area of concern. So just keep your eye out for that. And as you're engaging with your medical practices, you want to ask them if these particular cuts would affect you in your area. Ask them early on. They may not know based on the way it's written. It definitely could. So you want to be knowledgeable of it so that way you can be prepared for it. The third area of concern, those who receive medical support or health insurance through the ACA, formerly known as Obamacare. That's the Affordable Care Act, meaning you get insurance through the marketplace. I get insurance through the marketplace. I carry my family through insurance from the marketplace. So that's Obamacare or the Affordable Care Act. Now it's going to become harder to get that insurance and to also keep that insurance. So what the data is showing and what the research is showing as a result of NPR really diving into the bill that Trump got passed in Congress is that policyholders will be required to update their income, immigration status, and other information each year. You have to update it every year as opposed to automatically rolling over. Many of you who are on the ACA, I am as well, the information, our health insurance would not lapse at all. It would just roll over. We were still required to update our financial information or any changes in our household, but we would still have coverage. What this bill is saying is that you will not have rollover coverage. I want to be sure that you are well aware of open enrollment, the dates when it opens, but also when it ends. So that way you can ensure that you have your information and your coverage won't lapse. Make sure you have the required information in so that way your coverage won't lapse. I feel like I missed an area. Nope, I didn't. So we had the work requirement to maintain Medicaid. Based on what's written here, it should not affect those who are caregivers, those who have a disability, and those who are seniors. The fourth area of concern would be those who are on Medicaid will now have to pay more to see the doctor. Typically, when you have Medicaid, you don't pay anything when you go to the doctor. But now, many people will now have to pay some out of pocket costs. And what this bill is saying is that states that have expanded Medicaid, South Carolina did not expand Medicaid, but there are some states that are expanded Medicaid. Now they have to charge enrollees up to $35 for some of their services if their incomes are between $15,650 and $21,597. This plan could cause at least hundreds of thousands of immigrants who are lawfully here in the U.S., including asylum seekers, victims of trafficking, and refugees. They may lose their insurance, their health insurance through the ACA by cutting off the subsidies that make premiums affordable. So, when you get when you choose your insurance plan through the ACA or through the health exchange, it tells you what it really costs, and then it shows you the subsidies, and it brings it down tremendously. So what they're saying is for some immigrants, those subsidies won't be there, and so the cost to actually have that coverage will be unaffordable. And because the premiums would be unaffordable, those people won't have insurance. So that means there will be less people on the ACA. right? There will be less people on the ACA, which is going to leave the sickest people on the ACA. And for those of you who don't know, insurance companies are in business to make money. So if you have the sickest people being covered, then that means the insurance company is paying out more for the sickest people, which means our premiums are going to go up. And that's the ACA policyholders, the Obamacare Affordable Care Act. Our premiums have the opportunity to go up higher because so many people will lose their coverage. And so the people who still have their coverage, we're going to have to pay a higher premium because the sickest people are going to maintain their coverage, if that makes sense. So those are the key areas, the 5 key areas you want to be mindful of as it relates to the work that I do, the positions that you all are in as family caregivers for an adult with a disability or caring for an older adult loved one with chronic illnesses and or dementia. Do y'all have any questions about the changes to Medicaid and the cuts to Medicaid and also the ACA? Now, again, this is what we see today. Based on the way this administration has been operating, the president could recall something he thought was good 2 months ago. He could change his mind and do an executive order. How that looks, how that goes, I don't know. Again, these changes are not going to happen overnight, but make sure you are reading your information that you're getting from the Department of Health and Human Services or the Department of Social Services, the information that you're getting from your health plans, or read it thoroughly, call and ask questions so that way you can prepare for what's to come. All right. Any questions about what we're seeing as far as the Medicaid cuts in the new plan? Thank you, Taylor, for your comments and your questions. Appreciate you. Thank you for providing this crucial information for someone who takes care of someone with dementia. Thank you so much for being here, and thank you so much for subscribing to the channel and being part of our community, because I don't know everything. I don't purport to know everything, but I do know that whatever information I share, I do look to you all as well for support and for guidance, because you're living it every day. I've lived it, but things change all the time. Thank you, Maggie, for your question. I'm on Medicare, but was eligible for a Medicaid program that pays my $185 monthly premium. Do you know if that will come to an end or be cut? Um, I don't know. That is an excellent question. The way the information is reading and what it's showing is that those who are on Medicaid, who are seniors, who have a disability, and those who are on Medicaid who are family caregivers, there should be no changes to your coverage. So, based on how I'm reading it, how I am interpreting it, is that you should not be covered. I mean, you should not be cut. There should be no changes at all to your services and your coverage. But I will encourage you to call your doctor's office and inquire. Call Medicare and inquire. So you are dually eligible. So basically, as you stated, Medicaid covers your premium. So um, whatever healthcare you utilize, whatever services, whatever Medicare doesn't cover, Medicaid picks it up, including your premium. So again, that should not be affected based on the way the bill is interpreted by NPR and other trusted members of the media. Excellent questions. Any other questions about the Medicaid cuts? So let's talk about some of the dementia caregiving resources. So this is for dementia caregivers. We know that Medicare does not cover long-term services and support. So what that means is Medicare does not cover for someone to come into your home to assist your loved ones with ADLs, activities of daily living, bathing, dressing, eating, ambulating from one place to the next. that is paid out of pocket unless the person has Medicaid. Medicaid typically covers long-term services and support. So Medicaid typically covers in-home care, someone coming into your house to provide assistance. And also provides respite. So respite is where you take a break as a caregiver and someone is there providing supervision or providing care for your loved one while you take a much needed break. You have to take a break. It's not a question of if, it is a question of when you're going to take that break. Now, if your loved one does not have Medicaid and they only have Medicare because they worked for state government and they have a pension, but that pension in no way will cover $25 an hour, 10 hours a week to provide care for your loved one, there are grants with the Department of Aging. So you would call your local Department on Aging or your state's Department on Aging or your local AAA. That's the Area Agency on Aging. And there should be some semblance of that in your county and in your area. They typically have respite vouchers. In South Carolina, it's up to $1,500, but that could change based on the funding that they get. Because again, we don't know how these cuts are going to affect us. But right now, these vouchers are still very much in play. You would have to ensure that you can get documentation from your loved one's doctor to show that they have dementia, and you could qualify for those vouchers. It's not a lot of money, but it is a start and it is something to help you provide that well needed relief and that respite that not only you need, but you've been getting on your loved one's nerves too. They need a break from you too. Contrary to what you may believe, they need a break from you too because we get so consumed with caring for others that we may be irritable, we may be angry, we may not have the patience that we need to provide that care. And they feel it, they see it, and they're going to respond to that. If you promote negativity, they're going to respond with negativity because that's what they know and that's what they have based on doing the best they can with what they have. So you have got to have a break. So that is one resource. Have you all heard of the Dementia Guide program? GUIDE. That is through Medicare. So Medicare is now making some effort to provide support for family caregivers who are caring for someone with dementia. So the GUIDE program, GUID, it is new. It's been in effect now for I think about a year. If you are an advanced if you are an advanced member of the channel, later today you will receive the links to access these resources for your loved one. But the GUIDE program, GUIDE, through Medicare is for dementia caregivers. This particular program provides education and information and training for family caregivers. It also provides a care manager, very similar to what I do in my practice. I have a geriatric care management practice. And what I do is provide care consultations for families. I develop a plan of care based on the information shared in the consultation. I put support services in place. I manage those support services for effectiveness and for efficiency, and I make modifications where necessary. With this program, which is covered through Medicare, you will have access to, again, education, training, information, and resources. And you will also have access to a care manager that is going to help guide you through the long term care process. Charmaine says, my husband has, well, I'm trying to understand what he has. They explained to me that it's vascular, but I'm a little confused. So, if they don't know what type of dementia your loved one has, they're going to say mixed dementia. And typically what we see is Alzheimer's disease and vascular disease. So vascular dementia comes about as a result of someone having strokes, having several mini strokes causing vascular lesions to the brain. But the doctor may see, and I'm hoping that it's a neurologist that your husband is seeing. The neurologist can see with the scans that it has been stroke activity, but there may be something in terms of baseline and or in terms of the cognitive test that they've done that makes them believe that it could also be Alzheimer's disease. And that's why they're saying that it's mixed dementia. And usually when we see mixed dementia, that is Alzheimer's and vascular. So I hope, Charmaine, that helps you, and I hope your husband and you are doing well. But make sure the neurologist is on the team, and make sure your husband's primary care doctor is privy to all the information, because the primary care doctor is the cornerstone to the comprehensive care that your husband and that your loved ones will need in terms of ensuring that their medical care is where it needs to be with dementia, because simply because they have dementia does not mean that they don't need to have good care. They still need to have good care. They still need to have quality care, holistic and comprehensive care. But that primary care doctor needs to be privy to all the information. If your loved one is taking over the counter medications, your primary care doctor needs to know about it, and actually needs to give you permission actually to take the over the counter medication. Just don't give them over the counter medication because you feel like they need to have it, because you're not their doctor. Again, you want to be sure that the doctor is well aware of any medications that you're giving them, especially over the counter. They need to know. So be sure that you're connected to their electronic medical record. Many primary care practices have access to an electronic medical record, or EMR. That way, you can go in there once you set it up with your loved one. If you're not their healthcare power of attorney, you're going to need permission. With even with dementia, yes, I'm actually going to have an attorney come on to talk with us about healthcare power of attorney, durable power of attorney, and those advanced care documents we need to have in place when we're caring for someone with dementia. She is phenomenal, so I can't wait to bring her to you all. Um, can you hear me now, Charmaine? You're saying no sound. Can y'all hear me? I hope so. This is rather frustrating. Um, but be sure that you are setting up the electronic medical record. You have the username and password with permission from the person. That way you can communicate with the doctor, the nurses, and you can communicate with that person's team. Ideally, you want their team, their specialist, and everybody to be a part of the same medical practice. So that way, when you're communicating in that EMR, everybody can see it. But sometimes that's not possible. And so when you have someone that's not in that practice, you want to be able to print off their information and give it to that specialist without having to go through records. Now you got to go through records for everything. I remember I used to go into the nursing homes and have somebody just pull the person's record off of the computer. But now they're telling me I have to go through records, which y'all know I still don't go through records, but you know. But if you're a part of that EMR, then you can print it out yourself. So just be sure that you are signed up. If you don't hear nothing else I say tonight, make sure you are signed up for your loved one's electronic medical record. That's going to save you a whole lot of time, a whole lot of effort, a whole lot of anguish, because you can actually communicate with their medical team seamlessly, and you will get a response back from the doctor way quicker electronically than you would via the telephone. It is the best thing since sliced bread. And I know that many of you have had the opportunity to set up the electronic medical record, but y'all didn't. I can say that because I was just like y'all. But do it. Just do it. Do it for yourself too. I'm telling you. All right, any other questions? Be sure you pop your questions in the chat. Again, it's a subscriber only chat, but it's a member priority chat. If you are a member, you'll get priority in terms of your questions being on screen and answered. There is a join button. Please be sure to join the channel if you have an opportunity at whatever level you're comfortable with. You will have access to videos dropped before anybody else has access to them. You'll have longer training video access. You will also have access to resources in your area if you're an advanced member. And then you also have member only chats and member only live streams where just you and I will be in here, and I'll be answering your specific question as opposed to being able to answer everybody's questions. But if you can't join the channel, continue to drop your questions under the videos. I enjoy engaging with each and every one of you. A lot of people joining on the responses because it is a community over here, and we need all hands on deck. Janie, thank you for your question. You said, what stage of dementia is continuously steering? Tell me what you mean by that. What is continuously steering? I'm not sure I understand that question. And if someone else understands that question, you can drop it in the chat too. I just need to better understand your question. You're saying what stage of dementia is continuously steering? I just need some more context on that one. Yes, Charmaine. Everybody else can hear, so make sure you have your volume on and up. I'm sorry you can't hear me. Yeah, so Janie, if you can tell me what continuously steering means, because I want to be able to answer your question. I'm not sure I understand that. Now, typically, in general, there are three stages: early, middle, late. Right? Early stages, they can still do things on their own. They just need some reminders. Middle stages, now they're at risk to be left alone by themselves, which means you might want to bring in home care, or in some cases, you may seek out of home placement because it's 24-hour support. And then late stages, that's when you may see that their communication becomes garbled, like they're gargling their throat, wash, wash. You can't really understand what they're saying. But I understand what they're saying. So it may sound like that, garbled, or they may stop communicating at all. And then there are some other diagnostic tools that says there are 5 stages. There is early stages, early to mid stages, middle to late stage, and then late stages. Right. So that's even broken down even further. And I'll tell you, in my book, A Dementia Caregiver Call to Action, I do talk about each one of those stages and what you may see in those stages in terms of behavioral responses. So be sure to grab the book. It's only like $11 on Amazon or anywhere you get your books, Books a Million, Barnes and Noble. And so I actually have that listed out in this book, A Dementia Caregiver Call to Action, The Journey. And it'll be a great resource for you to be able to refer back to. Then there are other diagnostic tools that says there are 7 stages. So you have those 5 stages: early, early to mid to late, late. Then they add 2 more. The first stage is no impairment at all. And then the last stage is end of life. And so end of life typically would be the person is not eating, not drinking, not talking, not walking. We call that adult failure to thrive. But I will warn you, there are going to be some moments where it looks like the person may be at the end of life because they may not be eating, they may not be talking, they may not be walking, but that may not be the end of life. They may not be eating, walking, talking because they may have an infection, or they may have an acute illness, or they may be depressed. People with dementia still get depressed, or they may not understand their environment because you have not communicated with them in a manner that they understand. So don't just assume because they're not eating and drinking and they're not talking or walking that it's at end of life. It may not be the case. Okay, you can hear now. Okay, perfect. All right, thank you, Taylor. You said that you're thinking that Janie is saying that the person is looking in the space. Is that what you're saying, Janie? Okay, all right. That is what you're saying. Thank you, Tila. Without looking with Okay, so Jenny, that is what you're saying. They're staring into space. They're not looking at the person. It is hard to say what stage that is. I will venture to say, without having assessed your loved one or knowing the situation and making sure, they're not having, I don't know if your loved one has any seizure activity, but sometimes someone could have a staring seizure, whereas they're just staring at something. I mean, it's not a grand mal seizure. So the grand mal seizure is when the person is actually moving a lot. They're moving rapidly, they're moving aggressively and violently. But then there are petite mal seizures where you won't even know that they're having a seizure. They may not even realize it, and they may just be staring, and we call those, staring seizures. But if they don't have any concerns with seizure activity, then I would venture to say that that might be the middle stages, because the early stages, they do just fine. They just need reminders. They're going to forget stuff. But if you remind them and you post the reminders, then they can do just fine. So I would venture to say, Janie, without doing any type of diagnosing, because I don't diagnose. I'm not that type of doctor. I'm not a medical doctor. I'm a doctor of education, licensed social worker and gerontologist. I would venture to say that's the middle stages. But have you talked to his doctor about, what type of dementia he has, if it is dementia, and what stage you think it might be? Now, your primary care doctor could assist with that, but I would probably venture to ensure that the neurologist takes the lead on that. And Taylor, that's a good question that you're asking. You said, how do you determine what type of dementia someone is suffering from? You don't determine that. We don't determine that. The neurologist should be the one to determine that, because the neurologist is doing the brain scan. The neurologist is doing the cognitive test. Should be doing the cognitive test. If your loved one has dementia, or you believe your loved one has dementia, and you do not have a neurologist on your team, you are taking medical direction from the primary care doctor, I would advise you sooner than later to have that primary care doctor refer your loved one to a neurologist. Many insurances now don't require you to have a referral. You can go ahead and make the referral. And I would advise you to go ahead and make the appointment at the neurologist's office, because a lot of times there's a wait. Sometimes there is a 2, 3 month wait. You want to go ahead and get on that waiting list and make the appointment the first one available. I don't care if it's 3 months out, and get on the waiting list. So that way, if someone cancels or doesn't come, they'll call you and you can get into that doctor's office, because the neurologist is going to do things that the primary care doctor just cannot do. They're going to do the scans, the MRIs, the CAT scans. They're going to have the cognitive test done by a geriatric psychiatrist. A primary care doctor does not do that. They don't even have time to do that. So that's where the specialists come in. So make sure that the proper specialist is on the team to do the proper assessment. So that way you can get a better idea of what type of dementia the person has. As someone said earlier, their loved one, they were diagnosed with vascular/mixed dementia. And that means they don't know which one, they can't say for sure which one it is, but they see signs and symptoms of both. So they would say mixed dementia, which is typically vascular dementia and Alzheimer's disease. So Janie, you're saying that he does not have any seizure activities. He's not eating, he's not drinking. All right. So does he have a neurologist? Would be my next question. Where does a neurologist fit in here? Because that's going to be very important. That's going to help guide you to better understand the stage that he is in, so that way you can ensure that you're better prepared. Hi, Dave. You're in the New York, New Jersey area. So that is a great question. Dave is asking, when will I be doing a seminar in New York or New Jersey? That is coming. That is coming. I am working with the group in New York right now on getting a training set up, probably in the fall. So be sure to keep it locked here so that you know when I'm coming to New York. And make sure y'all are on my email list as well. If you go to my website, drmaciesmith.com, that's DRMACIE Smith.com, and sign up to be on my email list. I probably only email once a month, if that. I only email if I got something to tell y'all. But I always post it here in YouTube. Make sure you check into your post tab, so that way you can keep up with what's going on with me and where I am. And be sure to drop your questions under the videos. Keep those questions and those comments coming. I try to answer and respond to each and every one of them. If you need more one-on-one support, make sure you subscribe to the channel. I'm sorry, become a member of the channel, join the channel, so that way you have access to my training videos. You have access to members only live stream, members only chat. If you're an advanced member of the channel, you will receive links to the resources that I talk about. It does take some time to curate those resources for whatever area you're in. So be sure that you click the join button under that level if you actually want to receive the resources that we're talking about tonight. All right. So thank you all for joining me tonight. I don't like to hold y'all long at all. Be sure that you have your alert button, is there's a little bell at the top of your YouTube channel. Make sure you click the notification button so that way you know when I upload a new video, you know when I go live, and you know when I post information. If you are a member of the channel, you will have access to that information first, and then the subscribers, and then the general public. So, Maggie, you have a question. I want to make sure I get all your questions in before I log out for tonight. All right, Janie, you say he does have a neurologist. I would ask your neurologist where your husband is in terms of the stages of the dementia that he has and what type of dementia he has. If the doctor has never told you what type of dementia he has, it's probably because you never asked what type of dementia he has. Some people don't think it's important to know the type of dementia a person has, but I think it's important to know the type of dementia a person has because it's going to help you plan for their care. And I'll tell you what I mean. For example, typically we see that people with Alzheimer's disease, they tend to have concerns with recent memory early on. So we tend to see that first. So if you know that early on this person is going to have pervasive concerns with recent memory loss, you know how to plan for their care. You know how to ensure that, okay, I know they're probably not going to remember this, so I'm going to remind them of this, and I'm not going to get upset when they ask me this over and over again because I know that this is going to happen. If a person has frontotemporal dementia, you know that they typically have concerns with mood swings and behavioral changes without any apparent triggers. So you know that their mood is going to be unstable. Their personality may change at the drop of a hat, extreme highs, extreme lows, because you know that you can plan and prepare for that. If they have vascular dementia, you know that they're going to have more so concerns early on. Again, all of these are going to eventually have concerns with memory and confusion and disorientation. But early on, again, you want to plan vascular. They may have more concerns with executive function, meaning making decisions about bank statements, being able to calculate those abstract things, right? Making choices, making decisions, putting certain steps together to complete a particular task. You know that early on they're going to have concerns with that. So it's going to cause more confusion, more frustration. So that way, because you know that, you can plan for that particular type of care. You can prepare the environment to ensure they're not overstimulated. So that's why I think it's important for you to know what type of dementia the person has because it's going to help with your planning. The more you know, the better you're able to plan. That is my motto. All right. Thank you all again so much for being here for the live stream. I do apologize for all of the cutting in and out because I think I said a storm is coming through. Continue to drop your questions. Be sure that you're signed up for my email list on my website, drmaciesmith.com. I try to respond to all of your questions. Be sure that you join the channel if you need more support, more one-on-one support. And when you join the channel, you can drop off anytime. You can join 1 month, drop off the next month, join 1 month, drop off the next month. You control that because you may need more support 1 month, but not as much the next month. So you control that. Be sure you grab my latest book, A Dementia Caregiver Call to Action. It spells out what that journey looks like from when you think the person has dementia to full on diagnosis. My first book is Frequently Asked Questions, where I actually break down the questions that I get asked all the time, more often than not. And it's my response to that. I talk about how to effectively communicate with someone with dementia, which is a resource that you're going to need and that you're probably going to refer back to over and over again. You can take it to the doctor's office with you. You can take it to the adult day center with you. And you can also share it with your loved ones. You know how you try to tell your sister how she's supposed to treat mom and how she's supposed to talk, but she don't want to hear nothing you got to say because you the baby. You can just give her my book because Dr. Macie said it. How about that? Well, thank you all again so much for joining me, and I will see you all next month. If you want to see me cover a topic in one of the live streams, send me a message and let me know, hey, Doc, I want you to cover this. I want you to dive a little deeper into this. Let me know. These videos are for you. These live streams are for you. This is a support and a community for you. Thank you all so much again for joining me, and you all have a good evening and take care of your loved ones, and they'll take care of you.